Okay, this video is called the three conventional medical systems. So, the medical system gets a good reputation, especially from acute disease. A couple things that give it a good reputation. First of all, people think that doctors are well educated, which is really a joke. The education of doctors in America is terrible. It's a disgrace. It's evil. It's grossly incompetent. And now people say, well, how could I say that? Because I know exactly what I'm talking about. Okay, I got 99s on my boards in medical school and in residency. It's the highest possible score. In pre-med, they don't learn anything useful. All this nonsense about physics and calculus statistics, that's irrelevant. It really is, okay? They don't learn anything about nutrition, toxicology, epidemiology, the things that actually make people sick. Okay, and then in med school and residency, same thing. So they're very, very poorly educated. But people think they're smart because they had to get good grades, so they sort of think of doctors, oh, this smart person who knows a lot about health. The reality is doctors are very conformist. They're very hardworking. You got to be a hard worker. But you don't got to be that smart, and you don't need to know anything almost. Okay, you just have to pass tests. All right. Then the next thing is it gets a good reputation because of acute disease. They're good at acute disease. You know, if you get in a car crash, they will stabilize you, intubate you, fix your fractures, transfuse you with blood. If you have a GI bleed, they'll transfuse you, do a catheter arteriogram, CT angiogram, embolize the spot, surgerize the spot. They're good at that. Scope you up and above and below. They're good at that. Bacterial infection, treat you with antibiotics, get a CT scan, map out the infection, treat you with antibiotics. If you got an abscess, surgically drain it, transcatheter drainage. They're really good at curing acute disease because they know the cause and you can remove the problem most of the time. Appendicitis, take it to the OR, quick appy, take it out, everything's fine. Diverticulitis with perforation, free air. They can surgerize that pretty quick. They can percutaneously do a CT-guided drainage, PAD, percutaneous abscess drainage. I did many hundreds of those. Conventional medicine is great at all this acute disease stuff. It cures people left and right. The most valuable thing, that emergency room cures a lot of people. Talking about abdominal abscess, asthma attack, respiratory failure, heart attack. They're good at getting a catheter in there, stenting it open. Cardiologists are great at that. Okay, acute kidney failure, get you on dialysis right away. Conventional medicine, great at all this, but that's only about 10% of the patients. Okay, the next thing I want to talk about is a little bit about end-stage disease. Conventional medicine is really good at treating end-stage disease. So end-stage disease is, again, chronic kidney failure, putting you on dialysis, doing a kidney transplant. You can't walk, you got a bad hip, they'll do a hip replacement, they'll do a knee replacement. You got obstructive hydronephrosis, you pop in a kidney drainage tube, percutaneous nephrostomy. I did hundreds and hundreds of those, okay? It's good at those things. Recurrent falls, get a CT brain, rule out subdural hematoma. Surgeon can come in there, drain the subdural hematoma. But what percentage of old people who fall get a subdural hematoma? It's about 1 in 100, maybe 1 in 150. It's rare. The vast majority of emergency room head CTs are all negative for bleed. But conventional medicine is good at that sort of end-stage stuff. That's about 20% of the patient. But here's reality. Here's where the money's made. About 70% of the patients have chronic diseases, and conventional medicine stinks at chronic disease. It's an embarrassing joke. What's the cure rate for diabetes, hypertension, coronary artery disease, peripheral vascular disease, cognitive decline? For all of these, it's essentially zero. Cognitive decline, it's close to 0%, maybe 1% with cognitive decline. Okay, I mean, that's a disgrace. That's like, when Dante went with Virgil to the gates of hell and it said, abandon hopes, all ye who enter. It never cures the patient. They just match the ill to the pill, send a bill every day. You milk them like a cow. They have to buy your pill. And you can't cure a dietary disease with a pill. We all know that. Screening studies are also a big gimmick. I've been, a doctor over 30 years, and I can tell you, if somebody tried to get me in a screening study, I'd run the other way. But patients love them. Hospital loves them. Most of the patients are complete ignoramuses. You tell them a screening study, and they jump on board to volunteer, and then, 5 years later, they're broke. They got a bunch of bogus diagnoses, and they're like, well, what happened? I met well. Yeah, you did, you dummy. Okay. So that's all the cancer screening and a lot of other screening studies. I run in the other direction. Okay, routine checkups, stupid. You don't want to go around, Like I remember my mother died of colon cancer, so I was worried about it. So I went and got a colonoscopy, and I went into the gastroenterologist's office. He's supposed to be the best one at the hospital I was at. And he starts feeling my neck, examining me, doing this real thorough physical exam. And I'm like, why is this guy poking all over me. Is he a homo or something? What's going on here? And it turns out, I found out the reason he did all that stuff was the more of a physical exam he can do on me, the more he can bill for. I was a young, buffed out young guy. There was nothing wrong with me except I let myself get ripped off by this BS artist. Okay? Let's see, what else? Mercury poisoning. Lots of people, they're all suffering from slow poisons. A lot of slow poisons. There's mercury in the high fructose corn syrup. There's mercury in the dental amalgams. Fluoride poisoning in your tap water and in your toothpaste and your dental cleanings. Don't even go for those. They're stupid. Root canal anaerobic toxins. Food poisoning with glyphosate, atrazine, animal protein, excessive fat, etc. MSG, MFG, aspartame, all this crap. So they're all being sort of slowly damaged by all this stuff. Endocrine disrupting chemicals, the estrogenic chemicals in your personal care products, etc., your deodorant, etc., detergent, laundry detergent, dishwasher detergent, and it's associated with the fat storage hormone causing obesity, fibroids, prostate cancer, breast cancer, anxiety, depression, bipolar. These mental illnesses a lot of times are mercury side effects and other side effects of the toxic world and the crap they're forced on them in public schools. Lack of purpose, atheism. All these things weaken people. Conventional medicine really has almost nothing to offer these people. It just lies to them, rips them off, gives them psych meds that cause a lobotomy, other drugs that don't work and cause side effects. It's a disgraceful embarrassment. It really is. It's like something out of the 1400s. It's savage, primitive crap, okay? And everybody pretends it's real. And you'll see these internal medicine doctors who think they know what they're doing. They're so ignorant. It's embarrassing. It's embarrassing. It really is, okay? And these are the same ones that won't invite me to give a talk. I know more than them by a factor of 10, okay? And I can also tell you, the smartest internal medicine doctors, they come to me for advice about internal medicine problems, which I find amusing. And I always do the best I can to help them, but I find that amusing. Okay, so conventional medicine stinks at treating chronic disease, but that's most of the patients, and that's where the money's made because they get them hooked on drugs for life, send them for all kinds of procedures. So anyways, that's how conventional medicine works. So if you got an acute problem, they're great at it. If you're in the end of the line, last year of life, last couple of years of life, they might be able to do something to help you with this sort of stuff. But here's where the vast majority of patients are, about 70% of them. Okay, so that's it for conventional medicine.